Health Department has published proposed amendments to the general health regulations to encompass what they've learned from the coronavirus pandemic. But there are concerns that these regulations could limit constitutional rights and that special regulations for a specific disease can't be applied generally to all notifiable diseases. The public has been invited to actually comment. So let's unpack this further with the University of Pretoria's Ignatius Viljoen. Ignatius, thank you so much for your time this morning. I mean, when we're taking a look at these regulations, your take.
Yes, morning, Faith. Morning to the listeners. I think our main concern in the article that we wrote is that we have existing regulations that deal with communicable diseases, and these regulations were designed or developed before the COVID pandemic. Then during the pandemic, early during the pandemic, the government published special regulations to specifically deal with the issue of COVID. And now when it seems that the pandemic is coming to an end, we find that the government wants to embed these special COVID-specific regulations into the general regulations. Now, from a constitutional or from a human rights perspective, our human rights are protected in the Bill of Rights, and some of these rights can be limited for a very limited period of time under special conditions such as disasters and emergency, when states of emergency are declared. Now, our concern is that the regulations, the proposed regulations, do not adequately address the situation under which our rights may be limited. So we believe that it is necessary for the government to really take up all of the learnings from the COVID pandemic. The government is actually obliged to do that under its recognition of the World Health Organization international regulations. But I think it would be more appropriate if effort is put into developing regulations that will generally deal with pandemics. Yeah. You know, our regulations, existing regulations, are dealing with communicable diseases, and I don't think we thought that in our lifetime we will have to deal with a pandemic of a global proportion. And so I think it could be worthwhile for the government to really take their time, develop proper regulations to deal with pandemics in general, whether they are COVID or anything else it may be in the future, rather than to do a quick rush job of cutting and pasting special COVID regulations directly into the general regulations.
I hear you, Ignatius, but then, you know, one says, where do we balance between the existing South African realities around vaccination? So we do understand that the Department of Health, I'm sure in many instances, is quite disappointed in terms of how many people have actually decided to get vaccinated. They're struggling with the 18 to 35-year cohort. They're struggling with getting more people vaccinated. We're sitting with about 44-45% of South Africans that are currently vaccinated. It's saying something about the uptake of vaccinations in the country. This is vis-a-vis the fact that we are dealing with a very real pandemic that is still taking lives on a daily basis, unfortunately. With these existing regulations that have now been extended and obviously open for public consultation, how then do you strike that balancing act between understanding that vaccination uptake has been low in the South African context and quite disappointing, vis-a-vis also when it comes to the regulations not impeding on our constitutional rights?
Right. I think under the National Health Act, which is Act 61 of 2008, there's a myriad of different regulations. One of them is the regulations on communicable diseases. I think there is a good reason for us to develop special regulations for dealing with epidemics and pandemics on a global scale, on a national scale, provincial scale, right down to a sub-district scale if we need to. So, and to put measures in place from the government to build capacity so that we can deal with these issues when they arise. I think the important thing is to make sure that we have a clear understanding what the trigger points are that we have to consider before we put these regulations in place. So we have to say, under Section 36 of the Constitution, a state of emergency must be declared, or a state of disaster must be declared. Then, if it is a type of pandemic that deals with severe upper respiratory infections, we go to steps 1, 2, and 3. You know, the purpose of regulations is to really say, how do we implement the Act? And so I think really, there's a real need for us to come up with a constructive proposal on how we're going to do it in future. I can't really comment on the current situation, but I think if we take a forward-looking approach on this, we should take the learnings that we have and implement and design regulations to take us into the future.
We'll leave it there. University of Pretoria's Ignatius Viljoen, thank you very much for your time this morning.